Donald Johannesson here for Which Way Your Health, and I'm at the 2017 Indigenous Drug and Alcohol Misuse Conference here in Brisbane.
This is an area that does need money pumped into it. The problem really is that the question is whether the money that has been pumped into it has been spent correctly.
Funding's important, but the point I made is that people on the ground who are recipients of this funding do make a difference, but I've also challenged them to think about their impact on individuals and families. And are there things they do well that they should share and exemplify, or are there things that they might be falling slightly short on but could, through rethinking, provide an optimum outcome that means we save more lives?
Culture is treatment, and treatment is culture. And the Aboriginal and Indigenous communities and community members know exactly what they need. If you can clear the wreckage of colonization out of the way, the community can bring forward its own healing properties and people can get well and be better.
Just this month, I trained 5 IWC staff in an Aboriginal healing methodology, and we will soon be opening a healing circle, because healing and not therapy is needed so very much.
Donald Johannesson here for Which Way Your Health, and I'm at the 2017 Indigenous Drug and Alcohol Misuse Conference here in Brisbane. This has been arranged by Bundaberg's Indigenous Wellbeing Centre. Speakers from all over the country are here to share their knowledge, take knowledge away with them to find out how we can combat illicit drugs and alcohol in the communities. The Federal Minister for Indigenous Health, Ken Wyatt, is here, and I spoke to him first up as part of this story of Which Way Your Health.
Okay, Minister, first of all, how does it feel to be here at this conference, seeing some of the work that are done by the people on the ground?
Actually, it's tremendous, because in talking with some of the people, the work they're doing on the ground is making a difference for individuals, it's making a difference for families. But it's also, I was just talking to a young lady who works for a company, and what the company is doing is encouraging young Indigenous people to come and work for them. There's some challenges with that, but they're doing well, and they'll continue, and she intends growing the workforce. But I think the experiences of all of them in the areas they work from across the nation means they'll be able to share the stories of the successes, and we'll hear about some of the jewels in the crown in the next 2 days.
Closing the gap, 1 out of 7 targets met. I mean, where can we go from there?
Well, we need to refresh the targets. We have to have a look at them. The child mortality one is challenging because it has not only a health component to it. Any child who dies from a homicide, a car accident, a fall, a poisoning or a drowning are included in those, and those are outside the scope of control by health systems. And so what I've asked for is for us to separate that so we can see areas that we're successful in terms of child mortality, but areas where we're going to have to develop some awareness programs about how do we prevent some of the homicides, how do we provide support to somebody who's thinking that way, but how do we also provide support to families about the awareness of drownings, poisonings, etc. So it's complex but not easy.
You threw a lot of figures around here at the conference. Is money the answer, funding the answer, or is that just a waste of time? Let's have a look at a new model.
Funding's important, but the point I made is that people on the ground who are recipients of this funding do make a difference, but I've also challenged them to think about their impact on individuals and families. And are there things they do well that they should share and exemplify, or are there things that they might be falling slightly short on but could, through rethinking, provide an optimum outcome that means we save more lives?
What about the role of NACCHO and those Aboriginal medical services that are community controlled? Should they play a different role? Should they be doing something different?
No, look, I think the complementary nature of the work that is being done by the organisations in here and the role of Aboriginal community controlled health services are important, because one focuses on alcohol and substance abuse, but the community controlled health sector provide a range of programs including mental health support initiatives. So it's important that everybody plays their part, but what we've also got to do is encourage mainstream health to equally play its part, and for primary health care networks to be a major player in helping to support those that require the level of resourcing, either in terms of support or funding when they apply for funding.
And finally, are we winning in the communities? Are we getting somewhere? Are we getting, healthier choices and everything like that in those communities? Are we doing the right thing?
I think we're far better than what we were 30 years ago. I think we've got areas, as I indicated, in terms of Murdy Parky and Broken Hill. Their results are stunning, and it's because they're wrapping services around families and individuals, but they're tackling some of the social determinants that impact on the health of an individual. So I'm optimistic. I'll continue to remain optimistic because I think we're seeing our people living longer and living better. We're seeing certainly our young people taking pathways into jobs that are very different to the types of jobs our parents had or we had. And we're now seeing an entrepreneurial element to our young people where they're setting up their own businesses and they're succeeding. So look, I think we're doing better, but we've still got a long way to go.
My full name is Wayne Mulvaney. I'm the General Manager of the Indigenous Wellbeing Centre, known as IWC.
IWC are putting on this conference. Great to see that there's a representation from around the country on this issue that with drugs and alcohol that need to be spoken about.
Yeah, no, it's fantastic that I think the response from the people around the country demonstrates the issues that remain unaddressed. And I think a conference like this provides a platform for people to come and tell their stories and learn from others and have discussions and actually it's also a good way to communicate without, around the meeting table, also without, government across the table asking certain questions. So you'll find it often at a conference the talk is more open and it's more down to earth and it's more community based. So which really where the discussion needs to come from. The problem is when we talk with government or others is often the topics are predetermined and the discussion is limited. And whereas a place like this, it tends to bring out a lot of the issues that may go undiscussed or people who are aware of it don't really necessarily want to talk about.
Wayne, Minister Ken Wyatt addressed the conference and I was amazed about the amount of figures that he threw around about how much money is being pumped into this sort of issue. I mean, does that surprise you? I mean, is that the answer? Keep throwing money at the problem?
Well, first of all, to answer the first part of the question, no, it doesn't surprise me the amount of money that's being thrown around. The second part of the question, does the money need to be thrown around? Well, that's a bit of a yes and no question. The reason for that is, look, this is an area that does need money pumped into it. The problem really is that the question is whether the money that has been pumped into it has been spent correctly or is reaching the correct areas. More often than not, we find with a lot of government funds, it often gets tied up in bureaucratic layers, all non-frontline service providers, and doesn't really reach the intended use. And that's the first thing I'll be looking at, is not so much for more money, but looking at readdressing that. Then once you knew how much money you actually had left that was going to the front line and reaching the services that's needed at the community, then we certainly could maybe make some improvements.
My name's Lee Lingwoodok. I'm a mental health social worker and I work for the Indigenous Wellbeing Centre in Bundaberg.
Lee, tell us about your particular role, a normal day for you at the Wellbeing Centre.
Okay, so I'm one of the counsellors there. We do have another psychologist, but I'm the only Indigenous counsellor there. A day for me is book sessions, but I also deal with crisis as well. We have people that come in there with really complex issues and it can't all be dealt with, but we try to make headway into whatever problems they're experiencing. So I help them out. I ring around for housing, for legal help. If they're caught up with child safety, I'll help out there. A lot of it is trauma related from childhood and they're just struggling to get by. Of course, poverty plays a big part in our people's issues. So I just try to pick out important areas there where I can give them some practical help and just guide them through that and try and get the pathways going so they can go out there and get that help. So when they leave our office, they've actually got a plan on what to do next for themselves.
Do you do a holistic approach instead of just a normal, day-to-day sort of medical treatments?
Yes, I do, very, very much so. I'm just down to earth and I'll talk straight to people. I'll be very honest and blunt with them about what they need to do. So, because there's people go through cycles of crisis and they just over and over and over go over the same problem. So I'll try and put into place something for them to stop doing that, to deal with issues so that they can move forward with other things. So a lot of our people are on drugs, alcohol. There always is child safety intervention. So if I could, if I had enough knowledge, I would like to introduce more Aboriginal traditional type healing, and I've recently got trained in doing healing circle work, so I'm now a facilitator of that. So I will be trying to work aspects of that healing circle work into what I do with people, and there's some of my clients that I've offered that to, and so when we do have a healing circle, some of those will come along and as a group and we'll do some healing there.
We spoke to Dr. Joseph Stone yesterday about healing and also about cultural identity. Cultural identity, do you see that is gone now because of illicit drugs and alcohol?
Yes, very much so. I mean, when we look back at our past, Aboriginal and Torres Strait Islander people, yes, we had our drugs, but they were only allowed to be used by certain men in the group and only at ceremony time. Now, with this Western way where all the drugs are offered on the street, you can go and buy anything off the street. Our people, because they're suffering trauma, poor mental health, because of the intergenerational stuff that comes down, they may not even be aware that they're experiencing that, but they do. And it presents out there in issues like poor mental health, not able to parent their kids properly, just that real sadness and hopelessness. So with my clients, I try to instill a bit of that no matter what they've done in the past, there's always, ways there to fix things and to move forward a little bit.
We heard the Federal Minister for Indigenous Health bandy around some amazing figures. The amount of money being spent, it just seems like it's not going in the right places. Would you agree?
Yeah, I thought that was really interesting too. And it's been I'm in my 50s, so I've been hearing about this stuff for 30 years or something, and governments are still doing it. They're not listening to us. They're putting, non-Indigenous managers in, people that are in control of the budgets and stuff, and the money's not going nowhere. It starts up the top, and what filters down gets to our people. It needs to go the other way. We need to fund the grassroots people on the ground, and there needs to be really, really big input from people who work at the front of all this stuff. I mean, we can use that money better if we had access to it. The other big thing that Uncle Ken was talking about was the fundings are only short term, like pilot programs, things like that. And even if the program is working, they still cut the funding.
Yeah, we've heard a lot of that too.
1 year or 2 years or 3 years. It's just, he did say, Uncle Ken said, we need funding for 10 years to start with, not 4, not 3. So I'm in agreement with that. And if we had that term of funding 10 years, I mean, there'd be so much that could be done.
And what do you want to get out of this conference?
Well, I'm hoping to just talk to people about what I see in my work, and that's disconnection. A lot of people are lost out there, and when, you know, they might come from a big family, but they still feel alone in the world. So my talk is mainly about reconnecting people to their families, to community, to their culture, to anything. Just connect them to something.
If anyone you know needs help in any way, please contact your local Aboriginal Medical Service Centre. I'm sure they can help. And for more information as well, go to the Indigenous Wellbeing Centre's website. Plenty of information on there. Make sure you go there. Thanks for joining us for Which Way Your Health.